All right, welcome back, everybody. On February 2, Minister of Health and Wellness, Dr. Chris Tufton, announced that Jamaica will be receiving doses of the Astrazeneca COVID-19 vaccine between February and March. So we asked Dr. Michelle Harris, non-communicable disease and mental health advisor at PAHO, to join us this morning to talk a little bit about this vaccine. Good morning to you, Dr. Harris. Thank you for being with us.
Good morning. Thank you for having me.
Good to have you. So this is good news for Jamaica, right? We should be happy to hear this.
Well, this is one of the things that we have been looking forward as a part of the total package to fight the COVID-19 pandemic.
Yeah, but we're getting, I think, enough to, what is this, between 146,400 and 249,600 doses of the vaccine. How far away can that go in helping us to start the real fight against this disease?
Okay, so this first set of vaccines that are coming are intended to go to the most high-risk persons, the persons at greatest risk, and those have been identified as the persons who work in the health sector, the frontline workers, both from the health sector and other services, as well as for the elderly. So, as you know, each person is required to have 2 doses. So if we're going to have the opportunity to vaccinate half as many persons as we have doses.
So, Dr. Harris, we were speaking this morning about this particular vaccine, and we heard in South Africa there were some concerns about the vaccine, and I think we said this morning that they've halted the program. I don't know if you heard the story. Can you enlighten us?
Yes, things are moving very quickly with where these vaccines are concerned. And you may have also heard that there was a variant, a strain of the COVID-19 that was identified in South Africa. Mm-hmm. So it was important to test to see if these vaccines that have been under development for some time would also be effective against those variant strains. And so word came yesterday that the South African results have come back, and they seem to be not as effective against the South African strain as for other locations. Now, what is important is that we need to assess the prevalence of the particular strain in a country. So for South Africa, they thought it prudent to pause and to revisit this. In other parts of the world where that strain is not prevalent, they have begun to use the Astrazeneca COVID-19 vaccine.
And just a follow-up to that, so is the suggestion that it will be safe for us in Jamaica? We won't have any problems with it in Jamaica?
We don't take these decisions very lightly. So at present, the World Health Organization is reviewing all of the data before it grants the emergency use license. So we're still in the process of awaiting that, and all of those things are taken into consideration. So this is a very thorough process. And so in the case of Jamaica, we were already awaiting that final emergency use licensing from the WHO. So I'm sure that all of this will be taken into consideration, and then the guidance will be given.
Because it is likely, Doc, that strain will get here if it's not here already, no?
Well, we have assurances that the Ministry of Health is undertaking to do testing of those positive COVID-19 tests those tests that have returned positive, to do genetic testing to determine what is the prevalence of the strain, or if it has actually arrived to the shores of Jamaica. So that is an ongoing assessment that needs to take place, and the decisions will be made as the information is available.
So let me ask you, the government says they're looking at 450,000 Jamaicans to be vaccinated by year end. We hear talk about how herd immunity comes about, and trying to get to that place where we limit the spread in such a way that it's no longer such a high risk. In your view, how many of us, or should I say, is this enough to take us on that road? How many more of us would need to be vaccinated? And what do you see as a kind of, rollout that would be feasible to have us looking at the back of this within a reasonable time frame, a year and a half? I don't know.
Okay, first of all, I would like to step back to say that prevention continues to be the hallmark of what must be done. We need to continue to prevent the spread of the disease and to maintain the very same strategies that we have been advocating even before the vaccine gets here.
So that's the
Now, in terms
masks, hand washing,
hands washing, yes, social
physical distance.
distancing,
Okay.
and generally being responsible. That is not to be forgotten because the vaccine is not going to necessarily prevent transmission. Even though AstraZeneca suggests that they may have an advantage where that is concerned, that is yet to be formalized. So we need to continue to maintain those strategies. Now, in terms of the herd immunity, from previous vaccines that have been used, we know that herd immunity is attained oftentimes not until 80% of the population is immunized. And so this is one of those items that are one of the things that is still being explored. So 450,000 doses, which would be 225,000 persons. Or if we in fact go for 450,000 persons, that would be 900,000 doses. That would be good. That would make a difference in terms of the healthcare workers, the frontline workers, the members of the police, those persons who are out front. That would be important. However, as we need to continue to prevent transmission, and when the evidence is in, we will know what approximately would be the amount of persons that need to be vaccinated in order to achieve herd immunity.
Dr. Harris, I was listening to Professor Winty Davidson, who deals with public health, and he was suggesting that the Astrazeneca would suit Jamaica because of storage and stuff like that. Is it the only vaccine we will get? Are we going to get Pfizer, Moderna? And what is the difference with this one? I don't know if you agree with the professor, but he was suggesting that to store it, we have that here in Jamaica already. What's the difference?
Okay, so the manufacturers advise of how these vaccines need to be stored. So AstraZeneca has the advantage that it needs to be stored between 2 to 8 degrees Celsius, which is the body of the refrigerator, for which that type of capacity is widely available in Jamaica. The Pfizer vaccine requires ultra cold storage, which is minus 70 degrees, and that is not readily available here in Jamaica. So I rather suspect that is what Professor Davidson was referring to. So it's easier to store the AstraZeneca vaccine, and the Moderna requires minus 20 degrees Celsius. Now, in terms of the vaccines that are going to be made available to Jamaicans, Jamaica has signed on to the COVAX facility, which is a WHO-led initiative with the support of numerous other significant agencies like Gavi, UNICEF, etc., to seek to get vaccines at a reasonable cost to all countries, to countries who may not be able to enter into competitive bilateral arrangements with the manufacturers. So COVAX is a facility that has been set up to ensure that countries can get up to 20% of their population vaccinated in early in the day. So COVAX facility is exploring a number of different vaccines. So AstraZeneca is not the only one. Pfizer is also available through the COVAX facility. AstraZeneca, as you know, and some other up to 10 other vaccines are currently being explored within the COVAX facility. The countries, however, are free to make bilateral arrangements with the manufacturers directly. And Jamaica has been in dialogue with the manufacturers directly. And the CARICOM has come out and is supporting the countries of the region and is also making negotiations on behalf of the countries of the Caribbean to purchase vaccines directly. So we're not limited to AstraZeneca. This is just a facility that was set up so that in the very early days, all of the vaccines are not necessarily sent to the more developed countries, but so that all countries would have an access to up to 20% of their population.
As far as you know, when should we get the first jab?
of the AstraZeneca?
Yeah.
Okay, so there are a number of things that need to be in place, and one of them is to receive the emergency use license from the World Health Organization. It is anticipated to be ready at any time, yes, and that is important. The other thing, it's dependent on the preparedness of the country, and we have been assured that the country has been very busy getting all the things in place, the necessary cold storage, the training, the identification of vaccination sites, because it's important that countries are ready and to go, because COVAX has indicated that they'll not send vaccines to a country that is not ready and have it sitting around. So the Ministry of Health has assured that most things, almost everything is in place. Now we await the emergency use license from the World Health Organization, and then shipment can take place. So the estimated date we were given was mid-February to late February.
Yes.
So all things being equal, that's when we expect to have the vaccination rollout.
All right, last one from me, Doc. Vaccine hesitancy is a real thing. We're talking about the frontline workers being among the first to receive their jabs, but many of them have indicated they are not interested. What would you say to those who are eligible, we're looking at to give the jabs first, and for those over 60 in that grouping that we're saying you need to get the shots first, about how they think about the vaccine and the hesitancy they have in taking it? Just a general word.
Well, I'd say it's important to air your concerns and seek reputable and credible answers to the concerns that you may have. And once you have been assured of these, you should press ahead. We've seen a lot of persons already having been vaccinated, and we also know that a lot of effort, a lot of rigor is placed into the assessment of these vaccines before they are given the license to be used. And so I've been encouraged persons that when the vaccine becomes available, they should accept it.
Okay. Thank you.
Will you take it?
I will. When my turn comes, because I'm a little way down in terms of priority.
Thanks for speaking with us, and be safe.
Thank you so much.
Dr. Michelle Harris, non-communicable disease and mental health advisor at PAHO.
All right, training volunteers to help those struggling with mental issues. That is after the break.